Hi, good evening. This is usmlevideos.net. Once again, welcome to our website at www.usmlevideos.net, where you can find hundreds of videos ranging so many topics that you commonly encounter in United States licensure examination. Tonight, I want to give you a few thoughts. In fact, the most important points you need to remember when you deal with alcohol dependence. It's very common. In fact, it takes a whole lecture just to describe the staggering impact. I mean, in terms of economy, in terms of healthcare, in terms of its effects on education, in terms of the deaths it causes, to describe its impact upon us. But let me give you some of the most important points. Alcohol dependency is a physiological dependence. It's manifested by evidence of withdrawal when the intake is interrupted. And as the patient drinks more and more alcohol, he also develops tolerance to it. And now, alcohol associated illnesses like alcoholic liver disease, cerebellar degeneration. I mean, there is a wide spectrum of diseases that are caused by alcoholism, starting from cerebellar degeneration in the brain to hemorrhagic gastritis in the gastrointestinal tract to alcoholic hepatic disease, such as fatty liver, or Wernicke encephalopathy, or Korsakoff psychosis, confabulation, dementia, retrograde and anterograde amnesia, and colitis, and even causing cancers that affect different organs in the body, cirrhosis of the liver, peripheral neuropathy, hypomagnesemia, hypokalemia. So there is a wide ranging of effects caused by this, and the stigmas, how you can see the patient and identify an alcoholic dependent patient. There will be alcohol odor on breath, alcoholic faces, the flushed face, the scleral injection on the sclera, the tremor in the hands, the ecchymosis, and the peripheral neuropathy manifested by numbness in hands and in his feet. So these are the issues we need to face in this problem. Now, alcoholism is a syndrome consisting of two phases. Number one, problem drinking, and number two, alcohol addiction. Problem drinking is just repetitive use of alcohol, just alleviate anxiety or depression. But alcohol addiction is similar to addictions to other substances like heroin or morphine, like that. There is definitely ethnic differences. Japanese, for example, have 40% of Japanese people have aldehyde dehydrogenase deficiency. Aldehyde dehydrogenase deficiency. That's why they are extremely sensitive when they take even a cup of alcohol. Now, let us see the symptoms and signs of alcohol intoxication: drowsiness, errors of commission, psychomotor dysfunction, disinhibition, dysarthria, ataxia, and nystagmus. And there will be also nausea and vomiting when we see these patients. Now, many patients develop withdrawal, alcoholic withdrawal, and that is defined by a whole set of symptoms and signs. The most important ranges from anxiety, decreased cognition, tremulousness through increasing irritability and hyperactivity to full-blown delirium tremens. Symptoms of mild withdrawal like tremors, elevated vital signs, and anxiety, they begin like 8 hours after the last drink, and they usually pass away by 3 days. But when it is full-blown like delirium tremens, it is an acute organic psychosis It usually manifests between 24 to 72 hours after the last drink. It is a medical emergency. You need to admit the patient and treat him or her inpatient. It is characterized by mental confusion, tremor, sensory hyperacuity, visual hallucinations. Patient says, I am seeing snakes and bugs all over the walls and all over my body. There will be some patients has auditory hallucinations that is almost similar to paranoid schizophrenia. And then there is electrolyte disturbances, hypokalemia, hypomagnesemia, diaphoresis, dehydration, cardiovascular abnormalities. So whenever you come across a patient with delirium, you should always remember to alcoholic withdrawals, that is characterized by delirium tremens in these patients. Now, alcoholic hallucinosis, as I said earlier, there will be auditory hallucinations, particularly persecutory in nature. Patient thinks somebody is going to persecute him, similar to paranoid schizophrenia. Now, organic brain syndromes caused by alcohol. Wernicke encephalopathy, very, very important. It is caused by thiamine deficiency. And the triad that is characteristic of Wernicke encephalopathy is confusion, ataxia, and ophthalmoplegia. Those are confusion, ataxia, ophthalmoplegia, typically of sixth cranial nerve. But when it is progressive, it also causes Korsakoff psychosis. It is characterized by anterograde and retrograde amnesia associated with the confabulation. So those are the main important points when it comes to organic brain disorders caused by alcohol. When you treat this patient, you should always give thiamine before you give glucose. That's a very, 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 very important point. You should never give glucose to these patients because they will progress into Wernicke encephalopathy. You should always give thiamine and then glucose. I hope you remember that. Then, what are the laboratory findings? There will be elevated liver functions, there will be osmolar gap, there will be serum uric acid elevation, triglyceride elevation, hypokalemia, hypomagnesemia. But the most definitive biological marker for chronic alcoholism is carbohydrate deficient transferrin. Carbohydrate deficient transferrin is the most definitive biological marker. But there will be also elevation of gamma glutamyl transpeptidase and mean corpuscular volume increasing, elevated MCV. That's a characteristic sign of alcoholism. Now, let me give you a few things on treatment. Very important is psychological. You need to help the patient, comfort them. The comfort could be, you can give that comfort because most of these patients, they are seeking some kind of help because alcohol dependency might happen due to anxiety in the patient's life. So you can refer to religious groups where they can get some spiritual help to get out of this alcoholism. You can give social groups like Alcoholic Anonymous. And then finally, when it comes to medical help, disulfiram, one of the most common drugs, it inhibits alcohol dehydrogenase. So when the patient consumes alcohol, it produces alcohol toxic reactions. Other drugs include naltrexone and also acamprosate. Acamprosate is also another drug used in this problem, and clonidine, atenolol, and atenolol, for example, it reduces tachycardia. It reduces anxiety associated with tachycardia. Then benzodiazepines like chlordiazepoxide. And the chlordiazepoxide, it actually is one of the most commonly used drug to treat this problem. Thank you.